Hi everyone. I chose to do my trifold education pamphlet on childhood obesity as this was one of the large needs of my well child. So, what is childhood obesity? Childhood obesity is a condition identified by excessive accumulation of body fat for children between the ages of 2 to 19. Obesity can be measured by calculating the child's body mass index, and this is also called a BMI. And so this is calculated using the child's height and weight, and then the child's BMI is compared to other children of the same sex and age. So, as a parent, if your child falls between the if your child's BMI falls between the 85th and 94th percentiles, your child is considered overweight. If your child's BMI falls between the 95th percentile and above, your child's considered obese. And if your child's BMI is in the 99th percentile or higher, your child's considered severely obese. The image below shows some of the what a BMI looks like and the body size comparison to that BMI. And so in order to calculate your child's BMI, you're going to take the child's weight, divide that by their height, divide it again by their height, and then multiply by 703. And this will give you a estimate of your child's BMI. But take into consideration there are other factors that affect BMI besides just your weight and height. But if you are concerned with your child's BMI or your child's weight, talking with your doctor is your best bet. Some factors that influence obesity that your doctor will also take into consideration is your child's growth and development. This will include any family history of weight-related issues, as well as your child's eating habits, their activity levels, if they have any difficulty sleeping, any psychological factors such as depression or anxiety, socioeconomic factors, and other health conditions that your child has. Increasing weight can be due to many factors, and it is important to talk with your doctor about any potential risk factors your child has so that they can be addressed and so that the risks of obesity can be mitigated. Some risks associated with children who do have obesity um, are heart disease, high cholesterol, high blood pressure, type 2 diabetes, sleep apnea, cancer, non-fatty, non-alcoholic fatty liver disease, joint pain, depression, and anxiety. So children with childhood obesity are more likely to develop these serious conditions early on in life and even later in life. So in order to help your child, it is important to know how to talk to kids about weight. There are many different ways to talk about it, but it is important to know or to encourage open dialogue. Talk with your child about their body image and their feelings about themselves. And make sure to not make negative comments about their body or your own. Your children are like sponges, they absorb information. And it's important that you lead by example. Always avoid the blame game. Never yell, scream, bribe, threaten, or punish children about their weight, food, or physical activity. It can lead to, again, negative body images for themselves. And then don't focus on their weight, focus on the health. Consider your child's overall health. It's more important that they are healthy and that they continue to form healthy habits than it is for them to drop a bunch of weight. And then some tips to help get your child healthy would be to one, increase the number of minutes of being active. Children should have at least 60 minutes of play every day. Limit the number of sweets you eat, including foods and drinks. Increase the amount of time spent outside, especially as the weather gets nicer. It's easy to encourage your children to play outside. Find activities your child likes to do. If they are creative, you can take them out in nature and try and create collages with the leaves, and sticks that you find out there. Limit the amount of screen time to no more than 2 hours. Also, increasing the number of meals the family sits down to eat together can show your child a good example of um, eating healthy and eating the right foods. Create family playtime. This is important as well. Shop for healthy foods together. Again, showing your child by example. And this goes along with getting involved with cooking in the kitchen. Your children are more likely to eat the food if they've seen how it's been prepared. And then it's important to prioritize sleep and get at least 8 to 9 hours a night. For children 12 and under, they should be getting 9 to 12 hours of sleep. And then also making sure you increase the amount of fruits and vegetables you're eating. So we'll go back to the back of the pamphlet. It's important to know the facts. Obesity affects 14.4 million children in the US alone between the ages of 2 to 19. Obesity affects all populations, though obesity does have a higher prevalency rate among Hispanic individuals. Over the past 50 years, childhood obesity has been increasing steadily, and for 12 to 19-year-olds, it's reached almost 25%. Um, that means that almost a quarter of the children between 12 to 19 are considered obese or have weight-related issues. So, if you are concerned at all, talking with your physician is the best bet. But if you have any more questions, please visit the following websites. Thanks.